Hi, I'm Dr. Chi, specialist orthodontist, business owner and mum of 3. Today I'm going to be running through your frequently asked questions about oral hygiene, and hopefully by the end of the session it'll be a lot clearer for you. What's the best toothbrush to use? With a manual toothbrush or an electric toothbrush, the most important thing is always going to be your brushing technique. Brushing your gum, brushing your tooth surfaces, and you don't miss any areas out. You want to do small circular motions. The amount of pressure you want to produce is very light. You don't want to exert a lot of pressure that's going to cause blanching of your gums, because then that can risk damaging your gums and the surfaces of your enamel. Now, with an electric toothbrush, the amount of force that's produced by the toothbrush head and the movements of the toothbrush head, that's going to be constant. That's going to be exactly the same all the way throughout, from the time you press the button of the toothbrush until the end. So in terms of effectiveness, the electric toothbrush will far outweigh a manual toothbrush. So the two main types of electric toothbrushes we have: sonic toothbrushes like Sonicare, or oscillating toothbrushes like Oral-B. A sonic toothbrush is far, far greater. It does about 30,000 brushes per minute, so theoretically it will remove more plaque. How often should I brush my teeth? The most important time to brush your teeth is always last thing at night. So saliva itself during the day is a natural cleanser to keep your teeth nice and clean. But when you're sleeping, that saliva flow has reduced quite significantly. On your teeth, there is always this invisible layer that builds up on the surface of your enamel, and that's called plaque. Now, what the plaque will do during the day is it will attract any food that's left behind. Bacteria will stick to it, and what the bacteria love is anything like carbohydrates or sugars. So what you want to ensure is that when you go to bed at night, there is no plaque left on your teeth, there is no food left on your teeth, by brushing and flossing your teeth efficiently and adequately overnight. The other time to always clean your teeth is ideally in the morning. We always recommend that you wait at least 30 minutes after you've eaten. Well, ideally you should change your brush every 3 months. So in a year, you should get through about 4 brushes in a year. Well, one of the reasons is you're going to have wear and tear of the bristles of the toothbrush. You may be brushing your teeth, but it's not effectively removing plaque or food off your teeth. So change it ideally every 3 months, or when you see the bristles starting to fray, if it's sooner than 3 months. Which toothpaste should I use? So the first is just your standard toothpaste, what we call 1400 parts per million of fluoride, which is the recommended amount of fluoride to have in your toothpaste. It really depends on your taste. Some people like minty toothpaste, others like plain, so it really depends on what flavors you like. But in terms of what it can do, in terms of effect, if it has 1400 parts per million, it will be doing the same job. Children's toothpaste, on the other hand, has a much lower concentration of fluoride. Young children tend to eat toothpaste, so they have much lower levels of fluoride. And also in the toothpaste itself, it's a lot less abrasive, because we don't want to risk damaging the new enamel that's forming on their teeth. There are toothpastes for people who have sensitive teeth. Sensodyne is something that we've all heard of. Often it will take at least 3 or 4 weeks to really start desensitizing a little bit on the teeth. It's not an overnight cure if you have slight sensitivity of your teeth. Whitening toothpaste. Do they work? They don't actually whiten your teeth, unfortunately, otherwise I'm sure we'd all be using it. It will sort of minimize or lessen the appearance of stains. It doesn't actually sort of whiten your teeth once you have those stains. Sort of using it regularly, the buildup of the stains will be less. Another type of toothpaste is called regenerative toothpaste. The particular kind of fluoride in these toothpastes have an ability to bond to a slightly weakened enamel, either due to consuming too much acidic drinks, foods. But what it will help do is try and bond to this weakened enamel to try and make it a little bit stronger. With erosion, the most important elements are lifestyle and diet. And if you're in control of that, then there's less risk of your enamel eroding or having that kind of effect. Thank you for watching. Please check out our page for more oral hygiene tips, and drop me a line anytime if you have any queries.